We are here today with Dr. Julia Raber, a board-certified OBGYN, the director of Midlife Health and Menopause for Mount Sinai Health System here on Long Island with an office in Wantagh. Welcome to Rebranding Menopause Podcast.
Thank you. I'm very, very happy to be here.
We're glad to have you.
Thank you.
Thanks. So tell us about the sandpaper in the vagina.
Yes.
Because everybody wants to know about the sandpaper.
Legit. So in my private practice, I personally am very humbled that patients can relate to me because I openly talk to my patients. I know it's TMI, but they feel if the doctor feels it, then it validates that they're feeling
I get
it.
that.
So it's very, very important.
I get that.
Yeah.
When I walk in, I introduce myself as Dr. Julia Raber, not Dr. Raber. I don't stand there with a white coat with my arms crossed. No, we are together with the help for the patient. So basically, what happens, unfortunately, in menopause with the lack of estrogen, the lining of the vaginal tissue gets thinner and thinner. Another good analogy to sandpaper is the Sahara Desert. So a woman could subjectively, meaning she just sits and she feels discomfort, burning like sandpaper in the vagina. So one of the treatments, non-hormonal treatments, yes, we have hormonal and non-hormonal, and a lot of women, and I respect, want a non-hormonal treatment.
Right.
So
I mean, we've gone over this, Sharon,
Correct.
so many times, all the hormonal treatments for
I am completely
for the situation.
no hormonal. I went through
And
menopause. Luckily,
and
blessed,
I respect
and
that.
But
fully,
I also don't want sandpaper in my vagina.
Correct.
I mean, in all
Correct.
fairness.
Nobody wants sandpaper in their vagina.
Correct. So for that, we're not related to painful intercourse. We're relating just to the feeling of sandpaper in the vagina. Personal is moisturizer. So like we have dry skin, hyaluronic acid really is now the go-to. There are suppositories. There are many companies that make this. It's a suppository 3 times a week, and it moisturizes the vaginal area so you don't feel the sandpaper in the vagina.
Does it
Now-
get melty? Does it leak out? Do you need to wear
Good
Kotex when you
question.
put it
Well, that's a
on
very
in?
good question. So it is a suppository. It's not a cream.
So then you should do it at night.
You do it at night, and it does adhere to the vaginal canal better than actual cream, which yes will come out and is goopy. Does
Now, are you
does it
having
come out
sex,
a little bit?
Obviously, after you put this in.
Correct.
Okay.
Correct. It would be better. Correct. Now, in addition to, I ask patients, do you feel that burning, or is it just friction and dryness, another term, rug burn, when you have intercourse? So lack of estrogen can result in painful intercourse. So that would
that rug burn.
rug burn.
How did I never hear that?
Rug burn.
Road
Rug
rash in the
burn.
veg. I mean, not a good
So,
vibe, but
so if you're having
I guess it's a
sex
good
on the
thing.
beach and crawling on the sand, that's a combination that you will remember forever.
Right.
So that would be a personal lubricant.
things to look forward to.
Yes. And you can definitely use the combination. So you have a moisturizer and a personal lubricant. That is for dryness and pain with intercourse. Silicone-based lubricants are the recommended ones.
Okay, what about the ones that we normally see on the shelves at the drugstore? Like they rhyme with "Hey Guy." You know which one I'm talking about?
Yes, I do.
Or they rhyme with "Windowsill."
Yep,
Come on,
that one
come
too.
on.
Got it.
Okay, you got it. Tell us about those.
So essentially, literature states that 1/3 of women, before they come to see a gynecologist with these symptoms, already have purchased one over-the-counter product.
So they've already done the "Hey Guy" and the "Windowsill."
Correct.
Okay.
And naturally, they come in a lot of times with burning and an increase of their discomfort. And that is due to the more common over-the-counter products. They're toxic to lactobacilli. And we need that. It naturally decreases after menopause. So that's the thing. Very important.
Okay,
to keep
wait a second.
healthy
So
vagina.
some
That's the other
of
take of healthy vagina.
some of the over-the-counter popular
Are toxic. Yes, to that.
lubricants are toxic to the vagina in the fact that they disrupt the
the
flora.
lactobacilli, which
The
promotes
lactobacilli. That's what I was gonna say,
which
but you
promotes
said it first,
a
so.
healthier vaginal flora.
Okay.
Yes,
vaginal
Right.
flora. I like
it's
that.
another one.
Like
We have a
little
lot
flower.
of pearls. We have a lot of pearls here, the vaginal flora. But yes, different topic, but
That's interesting.
Microbiology of the vaginal flora of the gut, that is another topic, but that is very important.
Okay,
Yes.
so
gut,
so
you
let's
get me on that
talk.
one.
Let's talk nightstand lubricant.
Yes.
What are you going for?
Well, we have a lot of silicone-based lubricants. Really, I mean,
I wonder. That's what we need to have on next, right?
Line them up on the
Yeah.
table and eeny, meeny, miny,
Yeah.
mo.
What's beauty and BS? That's our next segment.
but
But I
remember,
guess
you
that
do
needs,
you
you
do
know-
have to educate patients, which I do. Do they work as well as hormonal vaginal supplements? No, but quality of life. I tell patients, I'd love to give you back your 25-year-old vagina, but I can't. I'd have a line around the corner, but I can't. So
I like
what,
that.
what I emphasize
thinking
is
about it makes me happy.
quality of life improvement. I'm not going to possibly make your symptoms completely go away with non-hormonal, but if it improves your quality of life, then we've achieved success.
So, question: if someone is not taking hormones, if that's not their path, they want to have a healthy sex life. Do you recommend using the suppositories for overall internal health in the area, and then the lubrication just during sex, or do you think the lubrication just during sex is enough?
No, I honestly think that it's a no-brainer. There's
To
no
use
harm
both.
in using the hyaluronic acid. I think the combination would work better.
See, okay, so now I'm going to bring this back to your face. So I use hyaluronic acid on my face, and I also use vaginal estradiol on my face because both help the vagina in staying thick
Supple.
and soft and supple. So that's a whole other episode, but let's not get into that.
The reason estrogen makes the vagina supple is because the cells that the vagina embryologically is made from are estrogen sensitive, different than the skin on your face. That goes into recurrent UTIs because the lower part of the urethra embryologically come from very similar cells than as the vagina, so that's estrogen based. That's why we use vaginal estrogen for recurrent UTIs.
Okay,
so it all
so-
comes, yes.
Okay,
yes.
so let's bring this full circle. If I'm not mistaken, as of November 10th, the black box warning was removed from some of the hormone replacement therapies by the FDA, and vaginal estrogen, estradiol, has been proven to be beneficial for most women, even if you've had breast cancer.
Correct.
Okay.
Personal history of breast cancer, personal history of cardiovascular disease, personal history of a stroke. We're talking about
Right.
not a month ago,
Right.
but a history. Absolutely.
So what would be the disadvantage of using that, of using a vaginal estrogen?
There is none.
There is none.
There is
So
none.
now, would you try it now, or
It's
you just
local.
don't- you
It is
don't-
local
is it
to the
symptomatic?
vagina. It is not the systemic absorption now. Don't even think about it. It is local to the vagina.
Okay, but for someone who has no symptoms, would you say that it's still a good thing to use as you get older? Because you might not have symptoms now, but you can be strengthening the lining of your vagina.
Right. I mean, it's a good. You're saying a
Like
good
to
point.
be proactive about it. You know, what do you think?
Prophylactically, should we be doing these things to help our vaginal health?
Or your longevity
as we
later
age?
on? Like, should you be
Because if I want to swing off a chandelier when I'm 75 and I start
exactly?
now,
And knowing
Correct.
you will want to swing off a chandelier.
I'll always
when
want
you're
to, as long as
75.
I'm not going to break a hip, I'm in. I mean, you know,
Legit,
we have to
legit.
think of all the things.
So essentially, especially if you've had an
miss you.
early menopause under the age of 45,
Right.
Yeah.
not having estrogen in your vagina does increase the chances of having urinary urgency and frequency, overactive bladder a bit, and also it can vaginal burning. You may have a healthy sexual life 10 years
Yeah,
later.
you need to start using
So-
vaginal estrogen.
So
I'm not
question.
saying it has to be preventative, but
Right.
at least educate the patient that you may, in 6 or 7 years, feel these symptoms.
Right.
It can take 3, 4, 5 months to improve them. So I'm not saying it's completely non-treatable.
Right.
We can start if you feel the symptoms. So it really, the preventative, it's individualized to a patient.
Well,
Okay.
Look, we say just in skincare, right? Start young, build up your skin.
There you go.
You know, so that's mucosa, obviously completely different body part,
you're right.
skin is skin,
You're right.
So if we're building collagen, elastin, the building blocks for healthy skin, wouldn't it be the same on every part?
100%.
Your body,
100%.
vagina.
Preventatively, what you're doing for, and the thing is, we know what's going to happen at 65. So it's not like we don't know. It's going to happen.
Right.
Right.
Your vagina is going to fall like some people's boobs. And what do you do when your boobs fall?
Gravity
you get a
always
boob
wins.
job.
Right.
I mean,
Of
not
course you do.
everyone
It's
is going to have
exactly what
recurrent
you do.
UTIs or urinary urgency or frequency, but we know it's going to happen.
Right.
So I'm somebody who currently has and has always been prone to very large fibroids.
Okay.
Vaginal estrogen. Would we have any concern because the hope?
Zero. The conference emphasized safe with fibroids.
Okay. Then I guess I would try it.
Because there is no
Why not?
so yes, estrogen feeds fibroids, but it's not systemic. It's local to the vagina.
Right. So let me just make this clear. So a systemic estrogen is more like a transdermal patch. Correct. So that's something that's going through your system.
Correct.
The vaginal estrogen is
Local
not. It's
to
localized
the
to that
vagina.
area,
I'm
just to that
emphasizing that.
area.
Correct.
So you're putting it in your vagina
Correct.
or around your vagina.
Does not
Staying there.
increase the
It's
risk
staying there. It
of
doesn't increase any
atypical
risks.
cells of your uterus.
Right.
Nope. Does not increase the risk, even in women that are positive for the genetic breast ovarian cancer gene, also does not increase the risk of breast cancer. Local to the vagina. I'm emphasizing that.
Okay, great. Now, in your opinion, when should women start using this if they do feel some as soon as they feel some discomfort?
Yes, because it does take 12 to 16 weeks. I mean, you
To
start
feel a difference.
No, to feel a significant difference.
Okay.
Right. It's not, I tell them, honestly, it's not like a Tylenol where in 48 minutes your headache is going to go away.
Right.
But compliance, standard dosing, you use 1 gram. It comes usually estradiol. I'm sorry, I said the name estradiol. It comes with an applicator. So, and it's scored 1, 2, 3, 4, 5 grams. 1 gram, but actually what the literature states now, if you don't have deep pain with dryness or painful intercourse, it really is more at the opening. So you can take the syringe, the applicator, put it on your finger, and you put it in the lower third. You don't have to push the applicator all the way in because you want the lower third where women tend to have more pain with entry. So you want, yes, you could put a little bit inside deeper, but
Okay.
you really want to emphasize also the lower third. And if you have urinary symptoms, you take a little bit of the cream and you put it around the urethra 3 times a week. So that's at bedtime for 2 weeks every night, and then maintenance 2 to 3 times a week. Maintenance. If you stop maintenance, you're going to go back 5 steps.
Okay,
I
same
say
thing as
this with
this. That's the same
all day
thing that she
long.
says with skincare.
Maintenance. So if a patient comes back in 3 months, how are you feeling? Are you using it? I used it for the first week.
Right.
So, right.
Like Sharon always
compliance.
says, everything happens the second you leave my office.
We can only be responsible for what we do
Right.
And
when
education.
you're here, and
That's
the
it.
rest is patient compliance.
Yeah.
100%.
So true.
It's just if you don't do it, it doesn't work.
Yeah.
Correct.
So this was amazing. Thank you
Thank
so
you.
much. I appreciate you being here. It was really a pleasure meeting you.
Thank you so much.
And
Same
can you
here.
tell people how they can get in touch with you?
Yes, absolutely. The Mount Sinai doctors, you can absolutely search for me. Appointments are available, and I would really love to see anyone that needs help in
Oh, this is
Yes.
amazing.
So do you specialize? I came in a little bit toward the end.
Yeah.
Do you specialize only in menopause?
No, I obstetrically that ship has sailed. So I am a gynecologist
Gynecology.
that offers full comprehensive care in it. Abnormal pap smears, pelvic pain, ovarian cysts. But I'm very, very honored that I was given this position as director of midlife health and
That's amazing.
menopause.
Oh, that's
'cause
great.
it's
Congratulations.
Really needed.
That's
It really
amazing.
is
It really
needed.
is.
Very much so. We
Yeah.
are not the forgotten ones anymore. Seriously.
No,
and
really.
vaginal estrogen replacement therapy can be used in your 60s, 70s, 80s, and 90s. You go, girl. You go, girl. Seriously.
So we'll take it
There
back
is
to the
no
nursing home
cutoff.
with us.
There is no cutoff age. There is no cutoff age. You don't have to stop vaginal estrogen.
I
You do
love
not.
that.
That's great.
Hear that, Connie? All right. Well, thank you guys so much.
Very
We're
welcome.
here at Rebranding Menopause Podcast, and we'll see you next week.
Hey, New York. I'm Harvey, proud owner of Optics and veteran in the eyewear industry. Consider this. Why would someone have a closet full of shoes but only a few pair of glasses when eyewear is the only accessory that completely changes the way you look, feel, and the way you're perceived? At Optics, Cartier, Chanel, Dior, Lindbergh headline our extensive collection of luxury eyewear. Our opticians are trained to style and fit your face to ensure that when you leave Optics, your friends will be wondering where you shop.